My name is Georgia Roark. I am a fourth semester nursing student. Today is March 29th, 2019, and it is 11:30 in the morning, and today I'm going to be doing a male catheterization. So beforehand, I want to make sure I have an order for the catheter and know what size, so I have a 14 French. I also want to assess my patient's condition. Last time he voided, what it looked like, the amount and color, and also check and see if my patient has allergies, especially to latex or betadine. Let's get started. Hi, Mr. Jones. My name is Georgia. I'm going to be your nursing student today. How are you doing? Good. Can you tell me your name and date of birth? Perfect. And do you have any allergies, Mr. Jones? No? Okay. So I pulled this curtain for privacy, but for now I'm just going to leave that. And I'm going to raise the bed up to a good working height. Mr. Jones, we're going to be putting a catheter in today. So I tell my patient what it was and why we were doing it. Put it up to a good working height. And put him in the supine position. Okay, Mr. Jones, I'm going to expose you now. Go ahead and expose him. Should still provide for some privacy. And put his legs in the frog leg position. Okay, and I'm going to put on the clean gloves. And I'm going to perform hair care. So 3 wipes. I'm going to do, starting around the urinary meatus and partly down the shaft. Throw that one away. I'm going to do that 3 times. And I'm going to get rid of these gloves and perform hand hygiene. Move all this out of my way. I am ready to set up my sterile field in the bed. Mr. Jones, are you still doing okay? Good. Okay, so with my sterile kit and gloves, I'd make sure beforehand that they were not expired or tampered with, or any watermarks or anything. Go ahead and get this set up. I'm going to open it away from me, and then the sides, and then towards me. Okay, so now I'm ready to put on my sterile gloves. I already made sure that my patient didn't have any allergies to latex. If my patient had foreskin, I'd make sure to pull that back when cleaning and then replace it after I was finished with the catheterization, but my patient does not. So I'm going to put my glove on my dominant hand first. Okay, and on my non-dominant hand. I'm going to resituate and resituate. Okay, so now I am ready to get my sterile field set up. So the shiny side goes down, and I want to protect my hands. I'm just going to lay it underneath here and leave it, and then I'm going to get my illustrated drape. Also the shiny side down and protecting my hands and leave it. Okay, so now I'm ready to get my stuff ready and set up. So I'm going to get my swab sticks ready. And my lube. And then I'm going to go ahead and set this up like this. And I'm going to go ahead and excuse me, lubricate my catheter. So for male it's 6 inches. Let's go ahead and get that lubricated. Then I'm also going to get my syringe hooked up and ready to go. So some policies say to fill the balloon ahead of time to make sure that it's intact and works. My hospital policy does not, so I'm good to go there. And also depending on how much to fill the balloon, usually it's 5 to 10 milliliters. Okay, so now this hand is no longer going to be sterile because I'm going to go ahead and clean. So starting around the urinary meatus and down. Do that 3 times. Okay, so now I'm ready to go ahead and insert my catheter into my patient. So I'm going to go ahead and get this, move this closer. Okay, so I would ask my patient to take some deep breaths and bear down while I insert the catheter. And for male, I'm going to insert it 7 to 9 inches. So when I see urine, I'm going to make sure to go 2 more inches. Mr. Jones, are you okay? Good. So then I'm going to hold with my contaminated hand 1 inch away from the opening and inflate my balloon. Now if my patient felt any pain or cramping or anything, I would deflate the balloon and go in a little bit further. So I'm going to go ahead and inflate my balloon. Milliliters. Okay, and I'm going to pull, see if I meet resistance. And I did. So I'm going to go ahead and get rid of this, and I no longer have to stay sterile. So I'm going to go ahead and get rid of these gloves because there's betadine lubricant on there. And perform hygiene. Mr. Jones, are you still doing okay? Good. Go ahead and get rid of that. And put on clean gloves. Found it. Okay, so now I can go ahead and I want to attach this to his upper inner thigh where there's not tugging or resistance. Make sure he has enough slack, and I would move this to an immovable part of the bed right here. And then this I would have ripped off, but for the sake of this video I'm leaving it on in case I need to use it again. So we'll just pretend it's not there. Okay, so then I'm going to take this and I would date and time and the insertion of the catheter when I did that. Move all that out of the way. And provide the pericare. Same way, just around the urinary meatus and down the shaft. 3 times. dispose of all my items here in the trash. And to make sure my patient is in a comfortable position, make sure there's no loops in my catheter and that the bag is not touching the floor. Hook this to the bed and get him comfortable. Mr. Jones, are you still doing okay? Good. I'm going to go ahead and lower his bed and give him his call light. Make sure he has that. And raise him to where he wants to sit a little bit. Okay. Make sure he has his call light. Make sure everything's cleaned up. Perform hand hygiene. And then I would go document the catheterization, what size catheter I used, how much I inflated the balloon, what the urine looked like, take a urine specimen if I needed to, and so I would record what the urine looked like, the amount, the color, and all of that. So now it's been a couple days, and my doctor has ordered for the catheter to be removed, so I'm going to go ahead and do that. Hi, Mr. Jones. My name is Georgia. I'm going to be your nursing student today. Can you tell me your name and date of birth? Perfect. I would provide privacy by pulling the curtain again and let him know, Mr. Jones, the doctor's ordered for us to take your catheter out, okay? So I'd tell him what we were doing and the procedure and why we were doing it. And back down in the supine position. Mr. Jones, I'm going to expose you now. Okay. Obviously this would not be here. And my bath blanket for privacy. And get him back in that frog leg position. Okay, I'm going to go ahead, put on my clean gloves. So I would check my order to make sure I knew what size had been inserted and how many milliliters the balloon had been inflated, because that's how many I'm going to take out. I'm going to go ahead and lay down a towel because there might be some urine spill out whenever we take the catheter out. Okay, so then I'm going to get my syringe. I'm going to go ahead and deflate my balloon. That 10 milliliters, or however much was inflated whenever they inserted it. Perfect. Okay, so 10 milliliters, perfect. Okay, Mr. Jones, I'm going to go ahead and remove your catheter now, okay? If you could take some deep breaths for me again. Okay, so I check my balloon and make sure it's still intact. And then I would go ahead and unclamp this from the bed. I make sure to dispose of the urine in the bag ahead of time. Get rid of my towel and the dirty linens. And dispose of the catheter properly. So now I'm just going to stick it all in here. Okay. I'm going to go ahead and apply hair care. I'm actually going to put on some new gloves because those had lube on them. So I'd inform my patient that the next time he goes to the bathroom it might burn or sting a little bit. Provide hairy care, same as usual. I'm going to urinary meatus kind of down around the shaft. Just get all that lubricant or urine off. obviously I would have this, that would not be there because I would have ripped it and taken it off when I inserted the catheter. Okay, put my patient back in a comfortable position. Get him all covered back up. Mr. Jones, are you still doing okay? Good. Lower the bed back down. Make sure he has his call light near him, so in case he needs help getting up to go to the bathroom the first time. And then I would leave the room and I would go document the type of catheter I removed, the procedure, how my patient tolerated it, and also the urine that I saw in the bag, the color, amount, and characteristics.